All right, peoples. I'm back with another video today, January the 28th. Right? Yeah, January the 28th. Exactly 6 weeks since my surgery. I did physical therapy today, so that went really well. The biggest news that I have to say today is that we were doing some stretching. Well, we were going through the regular routine, and I talked to the guy, and I was just wondering if we could do a little bit more stretching because my knee felt good or whatever. And I was having some trouble trying to break the 30-degree mark, I thought, or whatever. But he ended up doing some stretching with me, and I was actually able to break 60 degrees flexion. We don't have any effects, so that's going to be our effects. But it wasn't, he was kind of guiding me and helping me stretch it. And I was able to get to 60 degrees, which is a huge milestone. Now, I'm not able to get quite to 60 with my regular heel slides. He said that's okay. We'll keep stretching it or whatever. So to keep doing my heel slides. Other than that, as you can tell, as far as my other videos, I'm in a pretty decent mood today. I feel like I'm getting a little bit better, getting a little, about to get closer and closer to my normal life. But I still have a long way to go. I don't want to jump the gun at all. But I am pushing myself. I don't go to the physical therapy again until Friday. So just to kind of give you guys an idea of what I've been doing, if you look here, I'm going to kind of move the camera. If you look, one of my trouble spots for me was the top part of my knee. It was really swollen, and there was a lot of scar tissue. I say was, but there still is a bunch of scar tissue. What we've done is, my fiance looked at some videos on YouTube to see what we can do to kind of get rid of scar tissue the most, and not the most, but the fastest. And it was a little bit of some massages that we were doing that I've been able to actually keep doing throughout the day. Basically, some of the massages were, taking your incision scar and just pushing it out like this, doing little circles on either side, obviously with both hands. I have to hold the camera, but obviously with both hands on either side. We were crossing over it, putting a good bit of pressure on it, pressure on there, just enough that you can handle to try to break up some of that scar tissue. Cooper strawberry. Jeff is stupid. So just to break up some of that scar tissue there, I think it's really helped. As well as I went back old school, like when I first had the surgery, and I started elevating my knee while I was icing it, which helped as well. Now, because of that, I think that's helped me with my flexion. One of the things that I kind of concocted was my little fort that I call of my little tower of power, or towels and pillows that I put at the bottom of my knee to kind of help it prop up like it is now. I think what I've been doing is a little bit of a stretch. Well, it's a little bit of a like kind of stretching my knee. And hold on, I'm gonna show you guys. Basically, I stack a lot of pillows and towels up, so I can rest my leg on here and kind of bend it over. And I've been letting it stretch like that for about 10 minutes every day, or try to every day. I think that's helped me with me getting my range of motion and everything. I have my band attached to it because every time I go higher and higher, I don't want to just put it on there and just let it fall. I want to see if it's stretching it too much. If I'm having pain, then sometimes I'll just hold my band right where the pain is, or right above it, so it's not too painful. Just last night I did this, and I couldn't let it hang like this. I was in a lot of pain doing it. And just today, after my therapy today, I was actually able to come home, and as you can see, I'm just chilling. and there's no pain, there's nothing. I can feel some stretching, but I really need to go higher. So I need to find another pillow or another something to raise this up a little bit more so I can bend it some more. So that's basically what I'm doing. After that, I've been doing some more leg raises where I'll pick my leg up and I'll have something to lift it over and go back, just kind of go over and back a few times, and then I'm pretty much done, and then I ice it. So that's pretty much it right now for week 6. Huge progress. I'm so excited that I was able to get the 60 degree flexion on it, and really there's like I said, I'm slated to go back to work on the 14th, February 14th. We're going to try driving here in a couple days just to see if I can even do it right now. I am able to get in and out of my truck on my own, to bend my leg just enough to get in there without any assistance now, so that's good. Other than that, I'm still kind of walking with both of my crutches right now, not really putting a lot of pressure on my leg, but sometimes I do. It just depends on how it feels per, my doctor's suggestion. If it feels good, then I can put a little bit more pressure on it or whatnot. But other than that, highlight of the day, we've got it down to 60 degrees. I just have to be able to practice on doing it on my own, not with the heel slides, or just keep doing the little pillow tower deal that I've been doing. But make sure you do that with caution, because if it's painful, then you may want to back it up a little bit. So other than that, that's it. See y'all next week.